people with severe lung disease associated with vaping have reported using a THC-containing product prior to their illness, while a minority of patients have reported only using nicotine-containing vaping products. So we have been very concerned about this particular situation, along with the dramatic increase in vaping that we have recently seen among our youth here in Washington State. In fact, the governor asked us last week to provide him with some policy options to address vaping, including a full ban on flavors. We're not waiting for the federal government, but are moving ahead with the governor's request. And as part of this, we're looking at what can be done through statute change rule or executive order. So in addition to considering changes in policy, we've also taken action to try to identify people in Washington who may have developed severe lung disease associated with vaping. So we've sent letters to our healthcare providers throughout the state asking them to report any patients that might possibly be related to this investigation. We're also looking at real-time data that we receive from hospitals to try to identify any young people who have recently been admitted to a hospital here in Washington with severe lung disease. When we identify somebody who might meet the criteria that CDC is using to be part of this particular investigation, we talk to the healthcare providers, we review medical records, and then we try to interview the patient to find out what products the patient may have been using prior to their illness. So as James mentioned, today we're reporting that we have identified the first confirmed case of severe lung disease linked with the use of vaping devices here in Washington. And now Dr. Duchin is going to tell you a little bit more about this particular individual and what people in Washington can do to stay healthy.
Thanks, Kathy, and good afternoon, everyone. I'm Dr. Jeff Duchin. I'm the health officer for Public Health Seattle and King County. And earlier this week, Public Health Seattle and King County identified a confirmed case of severe pulmonary disease associated with e-cigarette use in a teenager who was hospitalized in the intensive care unit of a King County hospital for 4 days in early August with acute respiratory failure. The teen is no longer hospitalized and is recovering at home. We do know that this teenager reported vaping with nicotine as well as a saffron-containing product, but our investigation is ongoing and we do not know the details about the type of vaping device, where the products were obtained, or if other substances were also used. Serious lung illnesses have been reported in people who use a variety of e-cigarette and vape devices and products, including THC and CBD-containing products, as well as nicotine-containing products, and the cause or causes of this outbreak remain unknown at this time. E-cigarettes and vaping are not safe. That's the bottom line. People should all know and understand that e-cigarettes and vaping are not safe. Everyone should be aware of the risk for severe lung disease and avoid using e-cigarettes and avoid vaping at this time until the cause of the outbreak is known. Youth, young adults, and pregnant women should never use e-cigarettes or vape. No one should ever buy e-cigarettes or vaping devices, liquids, or other products off the street, for example, products with THC or CBD. No one should modify e-cigarette products or should add any substances to these products that are not intended by the manufacturer. And although e-cigarettes have not been shown to be effective for and are not approved as a smoking cessation method, we're aware that some people use them in this way. People who want to quit or reduce their cigarette smoking should consult with their healthcare provider for effective and evidence-based treatment options. Our Washington State Department of Health has a website for resources to help quit tobacco and marijuana. Check it out if you want to do that. As Kathy mentioned, there's interest now in doing more to reduce the use and availability of e-cigarettes and vape products by teens. In King County, 1 in 4 high school seniors has reported using e-cigarettes in the last 90 days. And if, unfortunately, King County is preempted from taking additional steps to regulate these products at this time, but if we had the authority, I would recommend that we would ban all flavored products so they're not as appealing to youth. There was sugar coating and addiction medicine, which is not an addictive drug, with flavors to attract youth, which is not something we should be doing. We could create a local tax to defer youth use, and we could implement preventive measures, such as licensing tobacco retailers so we can regulate point of sale to ensure retailers aren't selling to youth. We can have point of sale health warnings, and we can have advertising restrictions. At this time, I will pause and Dr. Ophi and I will both be available to take questions.
So it sounds like, as far as you know, the teen who got sick in King County did not use THC products?
Our investigation is incomplete. We don't have complete information on what products may have been used. All we know is that this youth reported to his healthcare providers using nicotine products and some sort of a saffron-containing product. But we don't know if there were additional products that were used. We don't know for sure whether THC or CBD or other products or oils were used. And we don't know the exact time frame that this youth was referring to when he gave that history. So there's still, as in the national investigation, there's a lot that's unknown, and that's why we're issuing the broad warning that people should be very cautious and refrain from using any e-cigarette, any vaping device, and take extra precautions around things that may be illicit and obtained on the street.
Is it safe to say that you are basing this off of the teenager's verbal speaking, saying that he had used vape, but there's no physical evidence that you guys have or the doctors have that can be able to say, yes, this is what he was using?
The information that I've shared with you is based on what the teen reported to his physicians.
Did the teen report where he bought these? Was it, you mentioned don't buy off the street?
We don't have any additional information other than what I've shared with you.
I'm just kind of curious if he knows if it was actually vape or something else that he was using.
What day was he admitted to the hospital?
It was early August, first half of August. He's late teens.
Can you guys help me to understand, because vaping's been around for like 10 plus years, so what I'm hearing you say is that the first case ever in Washington has been discovered when all of this is popping up. Are you guys just looking for them now, and they maybe been around for a while?
So I'll start and I'll let Dr. Lofi finish. It's because there's a lot to say on this point.
Okay.
But what we're seeing now is probably a combination of things. We know that e-cigarettes and vape devices contain potential toxins, a large number of potential toxins, and there's no long-term safety studies on e-liquids. These ingredients, many of which are deemed to be safe by FDA, are deemed that way for ingestion, not for smoking. They get heated up. They can be combined in many ways and result in unanticipated adverse health effects. It's my opinion, it's likely that many adverse reactions have been happening but haven't been recognized, and with increased scrutiny, we're recognizing more. However, I also believe that something has changed recently in the states that are reporting cases, either in the way users are using products or the availability of specific products that have a higher risk.
Okay.
Yeah, and I'll just add that we have been proactively looking for cases here in the state for the past few weeks.
Right.
As I mentioned, we're looking through data that we receive from hospitals. We've also been looking through our death certificates to see if maybe that there was somebody, who potentially, could have died who we maybe did not recognize. So we have had a very proactive approach over the past few weeks.
So it's possible in the last decade there have been other cases, but you guys have been looking. Now, help me to understand in this specific case, someone just asked, this is a teenager who said, yeah, I vape, and I probably sucked down some stuff that I shouldn't have. What is the disease that he actually has? And you say he's already out of the hospital, so it's not something that he will continue to have?
Well, the illness that this individual had and that have been reported across the country involves inflammation of the lungs, so primarily at the area where the oxygen enters the bloodstream, the very small little air sacs. And it's thought that there are a variety of different potential toxicities that can result in that inflammation. Some people have more severe cases, some have milder cases. It can result in something called the acute respiratory distress syndrome, which is very severe, from which people may not recover. There have been 6 deaths reported nationally. So there's a spectrum of illness, And part of that spectrum of illness is probably related to the specific things that the individuals are exposing themselves to through vaping, the toxins in the vape, what combination of products they're using, and the dose that they're getting, how frequently they're doing it, and how much they're inhaling. So there's a variety of severity that, there's a spectrum of severity that can be seen depending on a whole number of factors. And it's important to remember, since we don't know exactly what is causing this, it's quite possible that there's more than one thing happening, that there are multiple different combinations or factors that are leading to lung toxicity that have to be sorted out still, and they may have slightly different clinical presentations.
You said it was inflammation of the inflammation of the lungs, but like, what was he physically struggling with? Like, what is?
So he had acute respiratory failure, which means wasn't getting enough oxygen through the lungs into the bloodstream, wasn't able to breathe normally, and needed to have supplemental oxygen. This particular patient was lucky and did not need mechanical ventilation, although many of the cases nationally have needed that.
So 2 points on that. One, you talk about you're looking at other records to see if these have been misdiagnosed or we didn't know it was related to vaping. The way that presents, is there another diagnosis that would be very common that you would look at that, oh, this could have been what we kept misdiagnosing vape-related illness at?
Well, I think there's a few things. One is that people may not have been taking the history around vaping when people come in with shortness of breath and pulmonary complaints. Another is that people may have been assumed to have had infectious etiologies, which are quite common, viral infections of the lung, or some other disease that isn't diagnosed. They call it idiopathic, reaction to something that was inhaled that people just don't understand. So whenever a new syndrome appears and you start looking for it, you first become aware of the more severe cases, because they come to the hospital and they get scrutinized to a great degree, and people pay more attention on figuring out what's going on. But ultimately, over time, it's more likely that there's a spectrum of illness with less severe cases that may have difficulty breathing but don't go to the healthcare provider, or go to the hospital but get sent home, or just have chronic low-grade symptoms that are also related to pulmonary inflammation to a lesser degree. So it's very typical, again, with new emerging infections or health conditions that you see the more severe cases first. It's quite possible this represents the tip of the iceberg with respect to the type of lung inflammation and lung damage that vaping may cause over the long term. But we really don't understand the long-term health impacts of e-cigarettes or vaping at this point.
That was actually going to be my next question about tip of the iceberg. So I don't want you to predict the future, but as you're gathering information and searching these records, I mean, are you going to get more reports of this pretty quick back? I mean, are you seeing indicators that there's a lot of these out there and you just haven't found them yet?
Yeah, so initially we're looking for the most severe cases. One of the challenges with, looking through data that we're receiving from hospitals is that there can be a number of different things that can cause, severe lung illness. And so a lot of the data we're looking at is fairly non-specific. So it's a little bit challenging to sort of sort through, we're still sort of learning, how to identify these cases in some of our data sources. If that makes sense.
So we're getting some specific questions from viewers who want to know, and I know you have given a kind of blanket recommendation that vaping is not safe, but some viewers are asking, oh, well, what about vaping flour? Or what about vaping nicotine without the flavor? What do you have to say about some of their specific questions on their products?
At this point, because we don't know what the specific issues are that are leading to the severe lung disease with respect to the vaping device or the products, we're advising people don't vape and use e-cigarettes. We don't know which products, which combinations of products, which ingredients in which products might be responsible for this. We don't know whether certain devices make it worse than others. Modifying devices and using illicit substances is suspected by many investigators as being a risk factor. So we clearly recommend against that at any point. But we because we've had cases and people who've used products that have been regulated, that have been purchased in dispensaries and not on the street, at least that's what they've reported. People who've only used nicotine products, we don't really know. We can't say that any particular product or combination of products is safe at this point.
Are you working with anybody in the cannabis industry, the dispensaries, or manufacturers of THC vaping? I mean, I know this case looks like it wasn't THC, but nationally it does. Are you reaching out to those folks at all to work with them?
Yeah, so I guess what I can say is that we have been working with the Liquor and Cannabis Board at the state level, and they have been they've been meeting to talk about really how they can be more proactive during this particular investigation. And unfortunately, we weren't able to have anybody from the Liquor and Cannabis Board here, but I really encourage you to reach out to them if you're interested in learning a little bit more.
E-cigarettes aren't regulated by the state or the federal government. Are you guys calling for regulations on what can actually go into an e-cigarette?
Yeah, so there are some regulations that are slowly kind of being put in place at the federal level, and then we have some regulations around e-cigarette products here in Washington as well, in terms of in terms of some advertising regulations, whether people can sample vaping products in stores, kind of things like that. But it's really the Food and Drug Administration that generally would be the one that would be really, regulating what's going into the products.
Do you think the FDA needs to do that?
I think that we need to know more about what's going into all of these products and what the potential health effects could be for these particular substances.
Can I just say, well, on that point, I agree with everything that Kathy says. I mean, you're getting at an important point now, in that there's little regulatory oversight over the manufacturing or purity of these products, and FDA really does need to accelerate their oversight of the manufacturing and purity. There's also little known about the long-term safety of these products, and that's not something FDA can actually make happen. That's something that's going to take time, and users need to understand that although the industry has been touting e-cigarettes as a safer alternative to cigarettes, that's a very low bar. Cigarettes kill 500,000 people in the U.S. every year. They are probably the most dangerous thing that someone can do to themselves from the health perspective. So saying that e-cigarettes are safer than cigarettes doesn't mean they're safe. They're safer than one of the most unsafe things you can do.
Are you confident that we're seeing a short-term impact of vaping and not the long-term impact that you're saying we don't know yet? Are you confident that these cases are short-term impacts?
No. I think that we're seeing a combination of things. We're seeing a combination of probably seeing a combination of background adverse health effects that are associated with e-cigarettes that were not detected previously, with something new that's happening that's brought this to our attention, and with the all the scrutiny that's being placed on people who use e-cigarettes and vape are turning up things that we wouldn't have seen otherwise that may have been going on for quite a while.
How difficult is it to pinpoint vape being the issue when you hear deaths are being pointed at as because of vape, but then there's other things, other conditions that they have that are, that could have just bigger significance in their death rather than just vaping? How difficult is it to pinpoint vaping? Mm-hmm.
So currently, the way that the CDC is identifying cases is they're looking at individuals who have reported vaping in the last, 90 days, individuals who have abnormalities on their chest X-ray that show that they do have, lung disease. And then they're also looking to see if infectious causes have been ruled out. So you, in order to be considered sort of a confirmed case in this particular investigation, the patient needs to have some tests that have ruled out infectious diseases. But as you mentioned, as we've mentioned, there's lots of different things that can cause, severe lung disease. So, it in some respects may be, the definition we're using is not probably 100% specific.
I was thinking a Hail Mary here. I mean, most likely they smoke cigarettes previous to this, or they use other products. Do you have a number that that show how many people had smoked and then started vaping, or do a combination of both?
We have data from our healthy youth survey, which shows how many youth who report vaping in the past 30 days. And we also have data on the number of youth that report using THC-containing products and the proportion who are vaping who report putting THC products in their vape products. So we do have all that data if you're interested.
This teenager, is he going to make a full recovery, or will there be long-term evidence?
It's really hard to know what the long-term prognosis will be for people who develop this disease because it's newly recognized. Hopefully, this person will make a long-term recovery. I think the people who have the milder illnesses are more likely to recover fully, and people who have more severe illnesses may have more complicated long-term courses. But it's impossible to say at this point. One other thing to mention about that last question is that, unfortunately, we know a lot about the adverse health effects of cigarette smoking. As I said, they kill almost 500,000 people a year in the U.S. alone. In young people, even if they're cigarette smokers, it's not typical to see, acute respiratory failure from cigarette smoking. So the older you get, it's true, people are more susceptible to different types of diseases, autoimmune diseases and other diseases that might lead to lung symptoms, but not in young people.
Can you talk more about that saffron-related product? What is that?
Well, all I can say is what this patient reported is using a saffron-containing product. It's probably a liquid. If you look, on the web, you can find lots of products that contain saffron. Evidently, it's a pretty popular additive to vape fluid. But we don't know anything about the particular product this guy used, whether it was a commercial product, whether it's something he concocted himself, or where he got it.
So it's more of a flavor, potentially?
Correct.
Is he old enough to legally buy nicotine products?
In Washington, it's 21 in Washington State. It's not yet. Okay, so yes. Well, this person actually was vaping for 3 years.
Is he 18 right now?
This person started. I can tell you that they started vaping before they were old enough to legally purchase, and that's probably enough.
The Department of Health is involved in the regulation of cannabis in this state. Are you guys confident that the vaporizers sold on the legal cannabis market aren't going to cause these illnesses?
Yeah, I guess until we know exactly what's causing the illness, whether it be a single product or a component of a product, we really just don't have any way of knowing if, that particular product or that substance is in our state and is being used.
What's the exact disease that this teenager has or had, was diagnosed with?
The patient had acute respiratory failure due to what was termed toxin inhalation.
Okay, and you said this is a newer kind of disease that's being discovered?
Yeah, this whole syndrome of respiratory failure associated with electronic cigarettes and vaping is just emerging, in the United States over the past few months. It's not something that had been recognized. There were a few case reports in the medical literature of severe lung disease associated with people who used e-cigarettes and vaping devices previously, but it was just a handful. This is an outbreak.
So acute respiratory lung failure associated with a foreign toxin, I'm not using your exact words in China, is the exact cause.
Well, I'm not sure what you mean by exact cause. I mean, this person had respiratory failure, which was due to his healthcare providers diagnosed it as due to inhaling a toxin, which was associated with e-cigarette use and vape use. And the patient met all the criteria in the case definition that we're using nationally as defined by the Centers for Disease Control and Prevention.
So what I'm hearing you say, acute respiratory failure, his healthcare provider determined that. He then admitted to using these devices over the last few years. and that is the determining.
That's right. That makes this person a case of acute respiratory or severe pulmonary, the way it's being characterized, the official terminology is severe pulmonary disease associated with e-cigarette use or vaping device, and that this person met the criteria for that syndrome.
Did this person have the lipid coating in his lungs, like many of the cases have?
Those tests were not done for this person.
So San Francisco has banned e-cigarettes. Is that something the county could do? Is that something you would push for?
Well, the county is preempted by state law from regulating tobacco products. So if we could do that, we could consider that. We certainly would ban all flavored products because that is what is attracting youth to this highly addictive habit. It's basically resulting in a generation of young people, successive generations of young people who start vaping and get exposed to nicotine, which was one of the most highly addictive chemicals that one can ingest. And the long-term health effects of the products that are being used for vaping and e-cigarettes are not known. The risk for subsequent tobacco smoking, are not known. It has adverse effects on the developing brain. It has adverse effects on the cardiovascular system. There are many reasons to do everything we can do to prevent youth vaping. The issue of whether e-cigarettes have any role to play in smoking cessation is unresolved, but currently there's no clear evidence that e-cigarettes are effective in smoking cessation, even though people are using them in that way. And I think while the jury's out, we would have to think carefully on the risks and benefits of banning all use in adults over 21. But it would be a policy option that should be very carefully considered.
So as the law stands now, the state is the only one that could ban.
Propylene glycol and vitamin E have been identified as possible causes of these illnesses. Both of those substances are not banned from Washington's legal cannabis vaporizers. Are you guys recommending that those substances go on that banned list?
I can speak a little bit to the vitamin E acetate. So the Food and Drug Administration and some state health department labs are actually collecting specimens that vaping products that cases have used prior to becoming ill, and they're testing these products to try to figure out what's in them. And the FDA and the New York State Health Department lab have both identified vitamin E acetate in many of the products that they've collected. To date, I don't think we really understand what the significance of that finding is, but it's certainly of interest, and there's a lot more work going on to try to really understand what that could mean.
And Kathy, can we expect to see some upcoming legislation here in our state as it relates to e-cigarettes?
I think very possibly. As I mentioned, that this is a problem that's very concerning, to our governor, and we are in the process of really exploring all different policy options, really to try to keep these products out of the hands of our youth.
So, final questions? You mentioned that you guys wanted to ban flavors in these vapes because they attract the kids. Well, for decades there's been Swisher Sweets and menthol cigarettes and other flavored tobacco products. Why pick at vapors and not go after those tobacco products as well?
I would just say that I think everything needs to be considered because we do have some flavored tobacco products too, and I think that those policies really need to be looked at the same time.
Is there any underlying health conditions?
Okay, so
Yeah.
Michael, and then we'll wrap it up there.
Did this teenager have any underlying health conditions that may have exacerbated this?
No, there were no underlying health conditions that would have explained this illness.
And final question from
I was just
radio.
confirming male or female for the.
Yeah, did you guys get details about like Warrington County? Are they a high school student, college student?
Yeah.
Girl, boy?
Male,
High school, college?
late teens,
19?
late teens.
You could be in high school, just started in college, been doing it for a while. Anywhere specific in Union County? Fair.
Okay, thank you.
Thank you.
Thanks, everyone.
Thank you.
Hey,